Hello, today we'll be looking at a very important topic, the cubital fossa. And today my focus is to teach you interesting mnemonics and interesting concepts that can help you to write essay when you're asked to write on this topic. When you're asked to write an essay about the cubital fossa, my interest today is to teach you how to go about it and to do it very well. So for us to write an essay about the cubital fossa, we will have a mnemonic that can help us generate the outline. This mnemonic will not just only help us generate the outline for the cubital fossa, but can also help us generate outline for other spaces in the body, for cavity in the body, for canals, and so on. So the mnemonic is ABC. A, all I need to know, which includes the definition, the location, and the functions. B for boundaries, C for content, clinical correlation, and conclusion. So with this, you can form an outline if you're asked to write an AC on the cubital fossa. Now, for all I need to know, the cubital fossa is a triangular shaped depression located on the anterior aspect of the elbow, bordered by the muscles and tendon. It is a key anatomical area that contains important neurovascular structure. This contains the location, the function, and the definition. It also showed us the shape of this fossa, which is a triangular shaped depression. Now the next is a diagram. If you're asked to write on any essay in anatomy, it is always important to draw and label the diagram because it will fetch you marks in that essay. So always bear it in mind that when you're asked to write an essay on an organ or any structure in the body, it is always important to draw and label that structure that you're asked to write about. Now the next is the boundary. The boundary for the boundary of cubital fossa is the superior boundary is an imaginary line connecting the two epicondyles of the humerus. The lateral boundary is the brachioradialis muscles. The medial boundary is Pronator teres muscles. The floor is formed by the Brachialis and supinator muscles. The roof is formed by the skin and the subcutaneous tissue, reinforced by the deep facial. And here's a mnemonic that can help you remember the boundaries of the cubital fossa. And this mnemonic is my brother's big sister rock. My brother's big sister rocks. M for the medial boundary formed by pronator teres. B, which represents the Brachioradialis, it forms the lateral boundary. The second B, which represents the base or the superior boundary, it is formed by an imaginary line between the epicondyles. The X, which represents the supinator and the Brachialis, form the floor, while the R, which represents the roof, is formed by the skin, facial, and the bicep aponeurosis. Now, finally, for this mnemonic, we have the C, which is the content, the clinical correlation, and the conclusion. For content, the content of the cubital fossa include the brachial artery, the median nerve, the bicep brachial tendon, and the radial nerve. And here's a mnemonic that can help you remember the content of the brachial artery for medial to lateral, MBBS. The M in MBS can help you know that it is from medial to lateral. Now, M represents the medial nerve, B represents the brachial artery, the second B represents the bicep brachial tendon, and the final S represents the superficial and the deep branches of the radial artery. Now, for clinical correlation, there's some important clinical correlation that you need to know, and they include: 1. Venipuncture. The cubital fossa is commonly used for venipuncture due to the presence of accessible veins like the middle cubical veins. Second is cubital tunnel syndrome. It is a compression of the ulnar nerve which passes posteriorly to the medial epicondyle. This may lead to sensory or motor deficit in the hand, affecting the little and the ring finger. We also have the brachial artery injury. Damage to the brachial artery can lead to ischemia of the forehand, resulting to urgent medical intervention. For conclusion, the cubital fossa is clinically significant anatomic region that involved in vascular and neurological structures, often utilized for medical procedures such as blood sampling, and also prone to conditions like cubital tunnel syndrome. So for you don't need to cram or memorize a lot of things about the conclusion. So in concluding an essay, what you need to know is just to know the function of the structure you're asked to write about, and knowing the function can help you form the conclusion for that essay, and this can give you free scores in exam. Now, if this mnemonic have helped you know how to write the outline in cubicle fossa, another mnemonics in the videos that can help you remember all you need to know when writing an essay in cubicle fossa, please give this video a like, subscribe, turn on the notification bell to know when I drop new content, and share this video to those that it will be beneficial to. Thank you for watching.